Thanks, Chloe, and good afternoon, everyone. And as Chloe says, a really warm welcome to you to this second learning event in relation to the Safeguarding Adults Review 21, which is looking at the treatment of residents at Temple Court Care Home. I'll introduce Simon Bennett to you a little later in the session today, but hope. Oh, could somebody just? I've got somebody who's not on mute. Yeah, brilliant. Thank you. And we're going to hear from Simon a little bit later on during the presentation. So just to explain, I'm the independent author for this review, and I was assisted by a panel of agency representatives to complete the SAR. It did take a long period of time. There was a criminal inquiry, there were various challenges, there was a huge amount of information to look at. We conducted practitioners and managers events, and ultimately, as Chloe said, this was published in November, so about a month ago. We have done a previous learning event in relation to the learning from this review, and that looked at some other aspects of the review. Bear with me one second. Yeah, I'm just checking we've got the slides right, Chloe. Sorry. And that was on the 6th of December, and that really looked at a couple of key areas around organisational abuse, how we identify it, how we identify when things are going wrong, what gets in the way of delivering a safe service, and what steps can we take to improve the life of our most vulnerable people. So today's event is going to look at another couple of aspects of the review, because I can't cover it all in the time that we've got. So we're going to look at the importance of communication and hearing the voice of the individual and the families. And we're also going to look at the emergency procedures and safeguarding, because what will become evident if you have read any of the exec summary or learning events, or if you have waded through my 57 pages of review, this took place between January and May 2020. So we're going to look at those two aspects. In terms of why I'm going to pick up the emergency procedures with you, you know, it's generally an issue that is number one on any community risk register, but actually a lot of people didn't have a concept of what an LRF was, a local resilience forum was, and how the response gets structured. And that sort of emergency procedure does not always stand up just in terms of a pandemic. It can be anything, anything like severe weather, flooding, etc. You know, civil emergencies, that sort of thing. So we'll have a look at that and how it links with safeguarding. Next slide, Chloe. Thank you. So, as I say, this review relates to the treatment of residents at Temple Court between January and May 2020. The purpose of a safeguarding adult review is about identifying learning that can improve practice, and therefore that it improves the experience of our most vulnerable people. It's not about blame. We have to get to the facts, but it is not about blame. There's other processes for holding people and organisations to account. This is about what learning we can get and how we can improve treatment and practice going forward. So Temple Court is in Kettering. It's a 54. It was a 54-bedded nursing home for older people and people with dementia. It was owned by Amicura Limited, which were previously Minster Care, and as many people will experience, you know, companies do change. The directors of both Minster Care and Amicura Limited are the same. Next slide, Chloe, please. Just to sort of outline for you the amount of agencies and individuals who were involved within the Safeguarding Adult Review. And as you can see, you know, there were 51 residents within Temple Court, or who had been within Temple Court, who came within the criteria for a Safeguarding Adults Review. we managed the board managed to contact 47 families who'd been involved, and I'm really indebted to both Suzanne and Chloe, who really helped with this, being able to contact individuals. And we spoke to 15 families in detail. And as I say, you're going to hear from one of the family members shortly. They were extremely candid, open, and honest about their experience and the perceptions of what had happened. And it's fair to say, um, all of them really, I felt, felt quite guilty about the fact that they were unable to help their relatives. And as you see, as we'll go through it, we were experiencing a national pandemic. There were some significant difficulties. So the other agencies involved, Amicura Limited, they took part in the review. They came to the table, and actually the whole review, I think, uh, has greatly benefited from actually being able to have them at the table. Um, the what was the CCG is now the ICB, obviously involved CQC. There was a CQC investigation ongoing, and whilst they provided information for the review, it wasn't reciprocal. I didn't provide any information to their prosecution. Um, Care home selection were the brokerage, if you like, between the acute hospitals and the placement of residents, patients out into different accommodation. Adult social care, the police, EMAS, both acute hospitals and the community trust as well were all involved and provided representatives for the review. Next slide, Chloe. Thank you. So I'm just going to give you a little bit of an overview and background. So if you've read any of the review, you'll know this, or if you were on the learning event previously. So as I say, it was a nursing home for up to 54 residents, run by Amicura. A little bit of background to it: in 2019, it received a rating of requires improvement when it was inspected by the CQC. And as part of the review, between sort of May 2019 and up to March 2020, we looked at, as a panel, their action plans, looked at their quality monitoring visits, any safeguarding concerns, and any whistleblowing. And there weren't many, but there were a couple of safeguarding reports in the early part of 2020, and there were two whistleblowing reports as well. What we found really was just that lack of coordination around the action plans in particular. And there was a change of manager at the back end of 2019 in about the October time. And there had been some improvements, but they weren't really being sustained. As I say, the safeguarding issues were around the deputy manager and some medication issues. And at the end of January, the CCG carried out their quality monitoring visit on the home in relation to a couple of individuals that they funded. And one of the whistleblowing concerns, which I remember looking at, was that the home had actually put on additional staff at the time they knew that the quality monitoring visit was going to happen. In early March, obviously, we were then coming into the period of the COVID pandemic, and Northamptonshire, as it was then, went into the emergency procedures, and the local resilience forum stood up in response to dealing with the pandemic. Temple Court itself closed its doors to non-essential visitors on the 11th of March. And then another significant date on the 19th of March, the government issued the national requirement to discharge all medically fit patients from our acute and community hospitals. And at that point, Temple Court had 33 residents in. Between the 19th of March and the 3rd of April, the care home accepted 23 new residents, and that was over that 16-day period. So a significant increase in residency within the care home. And then on the 23rd of March, as you remember, we went into a period of national lockdown. On the 28th of March, Temple Court reported via its registered manager that one resident had developed some symptoms of COVID, or suspected COVID. And I suppose what I would say here is that, whilst we're going to talk about emergency procedures, COVID, etc., this is not all about COVID. It's an exacerbating factor within what happened within the care home. Next slide, Chloe. So between the 6th to the 9th of April, staff at the home started to become symptomatic and began to isolate. And on the 9th of April, the registered manager herself also began to isolate. There was a period really between that time, sort of the 6th of April to the 20th of April, where there was a distinct lack of contact by either the emergency system, if you like, that was set up to support and to manage the situation, and also the senior management within Amicura Limited. They didn't have the oversight on what was happening within the care home at that time. So there was a period of time where I can't find, and the review panel couldn't find any evidence that there'd been any contact with the care home. There were two whistleblowing concerns raised to the CQC, as you can see, on the 13th and the 15th of April. And essentially, they were quite similar. They're both related to poor treatment of residents, in particular things like the lack of continence care, call bells being removed from people's rooms, understaffing at the home, agency staff running the home, unexplained bruising on some of the residents, medication issues, and then issues also around hydration and nutrition for residents. On the 20th of April, a quality improvement nurse contacted the home and discovered what was occurring, that they'd got that lack of clinical oversight, that the registered manager was isolating, and that the situation there had significantly deteriorated. Resulting from that, there was a lot of action, some joint action taken between the local authority and the CCG to try and resurrect the situation and support the home. And there was a tactical health team deployed into the care home on the 2nd of May. At that initial time, a number of residents were immediately moved due to their ill health. But over that next sort of 10-day period, it became apparent that the home could not really turn itself around. And on the 11th of May, a decision was taken to transfer all of the remaining patients to alternative accommodation. I think it's fair to say the tactical health team, when they were deployed into the home, found a fairly dire situation with individual residents partially clothed, found in wet beds, wounds not dressed, and people not really assisted to eat or drink. So really, basic needs not attended to at all. The period of time that we reviewed, 19 residents had sadly died. 4 are documented to have died as a result of COVID, and the others in a relation, in varying other illnesses, sadly. Next slide, Chloe. So in terms of the findings, particularly in relation to the quality monitoring and how improvements are monitored following inspections and that kind of monitoring activity. Temple Court was really by I can't remember, there's one of the practitioners or potentially one of the managers, as a bit of an anomaly. And in terms of how it was monitored, and the action plans were kind of coordinated, it wasn't. And from the review, really, it was felt that the monitoring process didn't really consider the full picture. There's a real need to think about what the whistleblowing reports were saying, and also some of the safeguarding referrals as well. And just along with the kind of soft intelligence as well, thinking about what family members had complained about previously, and just building up that much more detailed picture of what was happening. Um, as I said a bit earlier, there was inconsistent improvement. There was very much a reliance on agency staff to staff the home, and there was a turnover of managers. There'd been 3 managers, registered managers, within 18 months. The lack of effective oversight and management, really, I think this is more in relation to considering how the system operated when we got into the emergency procedures. That actually there was a requirement to move people quickly and in volume out of hospitals, because there was a general concern nationally that our hospitals would be overrun. But who had that full picture of the amount of individuals going into other bedded accommodation and what the likely impact was? Without a doubt, the large number of new residents, too many residents, put too much pressure on the care home in that short space of time. The normal rate of admission um, would be 1 or 2 per week. So that is significantly up. And at times, the information that was passed between the hospital to the care home was incomplete or inadequate. As I say, the impact of the decision people in that way and in that volume, I don't think was fully understood. And was that particular care home suitably equipped and staffed to take on such a large number of new residents? The emergency system, the LRF, the provider hub, and the hospital transfer cell that was set up, what oversight and how aware were they of the situation within the care home and the COVID cases? Well, the registered manager did speak to a couple of individuals at the beginning of April, one from the CCG and one from the local authority, but she didn't actually report COVID cases as required. And if you remember going back to that time, what was an outbreak and when did it need reporting? It was about 2 or more individuals who were clinically suspected to have symptoms, and it wasn't reported in the correct way. So the information was within the system, but it wasn't reported correctly. The other finding was that in this situation, and in many across the country, to be fair, the care providers were somewhat passive, if you like, and they weren't really involved in the process of making the decisions. They were very much key stakeholders in the process, and could have been involved within that structure and within the decision making. The oversight, the governance, and the grip of the management at Temple Court was absent. The senior management within Amicura didn't have a good enough grip and oversight of what was happening, particularly within this care home. And whilst a lot of people, quite honestly, had to roll up their sleeves and become involved in the day-to-day care of individuals. There still needs to be that oversight, that management, and understanding of the situations which are going on. It's called, business continuity and being able to keep people safe. And one of the final recommendations that I made within the review was about continuing this national conversation with people within the Department for Health and Social Care around the recruitment, retention, and progression of social care staff. They are heavily relied on, often poorly paid, trying to keep well qualified staff and experienced staff is really, really difficult. I think that this can go off the agenda if we don't keep saying this is something that is really, really important, particularly with our aging population. So that's a brief overview of the Safeguarding Adult Review and the findings. And what I wanted to move on to really next, Chloe, next slide, is really the importance of that whole thing around communication within this arena, if you like, and the involvement of individuals and families. And I'm really delighted that today we're joined by Simon Bennett. Simon's father, Robert, was a resident at Temple Court Care Home during this whole period that we've conducted the review. And I always think it's really important to understand from somebody who has that experience and we'll have some key messages for you, no doubt, around things to consider taking away from this review. So Simon, are you there? You are. Brilliant.
Hello. Can you hear me?
Hello. Yes, absolutely. Okay. I said to Simon, what I'd like to do is just ask a few questions really to just get the kind of full picture from his perspective. And kindly he's agreed to do that for us. So can we just start off, Simon, just give me a little bit of an overview about your dad, Robert, and how he found himself to be at Temple Court?
Yeah, he had a stroke. I can't remember what, it must have been 2019, and he was at Northampton General Hospital. He was discharged. They were giving him stroke rehab, but that wasn't working at all, and he was getting more and more like sort of frustrated, and they were saying, "Oh, can you make a sandwich? You need to throw the bread around," this sort of thing. And it was a case of like something else was happening, and it was sort of showing signs of quite a rapid onset sort of vascular dementia. And he was at home with my mum, and my dad was late 70s, early 80s, and my mum couldn't cope. He was just getting quite violent and quite agitated, and he spent a bit of time at St Mary's in Kettering just to sort of work out and kind of sort of stabilise him a bit. Then he came out again, and it just didn't work out again at home, and he went into another care home in Kettering, and then we got in touch with the council to see if we could get a longer term solution. And in true council style, I think they gave us a choice of 3 homes. They went, right, there's your 3. Go and have a look. And Temple Court stood out really because it was kind of, it was all new and shiny. I think there was no one. I don't think anyone was there at the time. I think my dad was one of the first ones to go in what would have been, I think, December 2018. I think, yeah. But it was and it was funny because I was talking to my uncle about it. I think his mother-in-law had been there when it was Dove Court about 4 or 5 years previous to that. And he went, "What? No, not Dove Court. No, can't go there." But obviously it closed down since Dove Court, and then was bought out by Amicura and reopened as Temple Court. But the place was very bright and lively, and the original manager there was sort of really quite positive. And as care homes went, my dad settled in pretty well. He wasn't a guy for doing the activities and that sort of thing. They go, right, we're going to do, I don't know, we're going to do some arts and crafts, and he just go, what's the point? Just sort of like, just throw it around. He really he struggled to know where he was. He struggled to know, who people were. His memory was very poor. Because he was an engineer, scientist before that, he had a reputation for kind of unscrewing doorknobs or taking stuff apart, or they'd find a laptop in his room. You go, how did you get this? And I'm just looking at it, So that's the reputation he got in the home.
Thank you. And I think when we first spoke, in those early times, the care you felt was pretty good. As you say, there was lots of activities there, and you got quite a proactive manager in the first instance. And when did you start to notice a difference and start to have any concerns?
Yeah, I mean, I think we had the first Christmas was like that December, end of 2018 was great. It was all, and the home was, slowly filling up. I think it was about, I don't know, 15 by Christmas. Then getting into the first 6 months of 2019, the home was starting to fill up. But again, it was all good and positive, and again, very sort of proactive. But I imagine towards the mid part of that 2019, it there was a change. There was a change of manager. I think it might have been two changes of manager actually, and it just felt a little like a lot of the sort of a lot of the good things were going. Really, it was just getting a little bit more rudimentary, a little bit more basic, and I think my mum, who lives in Rothwell, used to come in every day on the bus and whatever. She'd be there most days, and she was seeing it as in, just seeing residents that were out, out of their rooms and wandering around, and or just things not really being cleared away, or so. Just there's a feeling that it was, the staff were under strain really, and again the staff were, really, really dedicated, but maybe just lacked that kind of like resource and perhaps training as well. Some of them, this was their first job in care. They might have worked in a shop before, and then all of a sudden they're, dealing with, quite complex needs really, and it's quite a leap, isn't it?
Yeah, absolutely. Thank you. And so we then move into kind of 2020, and say the home closed its doors to non-essential visitors on the 11th of March. Um, how did you experience it when we went into the sort of national lockdown? Did you get much information, and how were you able to keep contact with your dad?
Yeah, I mean, I think Temple Court were pretty good at the start. They were keeping people informed, as much as they could, and I think that period of early March, it was like, you know, again, because my mum was sort of going down nearly every day. They were sort of saying, "No, we're open," and then they made a decision I think quite abruptly. I think, and I think my mum went. I think she even went down on the day, and they basically said, "No, no, no, we're shut now." And it's like, "What? Shut?" But I've got some stuff for him. Oh, well, leave it there, and we'll. But again, I think that felt like it was going to be the same for all care homes at that point. And I think the problem with trying to communicate with my dad was, it was no, he could try and speak to him on the phone, but he'd have the phone and then he'd just leave it. And it was just like, hello, and he couldn't use an iPad or that sort of thing. So yeah, yeah, contact was very much through the nursing staff, in terms of just to know anything really, because he couldn't say what he was getting on, or but
Yeah,
again, I mean, I
there's
think it's interesting going back to that first few weeks. We all thought, is this going to be a 6 week thing, or all going to be great, or no one really knew, did they? So it was a weird time, wasn't it? We're all panicking and scrabbling for groceries, and trying to
yeah.
smuggle things in, and trying to, we were shipping in a package of toiletries to the care home and just all that sort of stuff. So that was that stage.
Yeah, absolutely. And so, how much information did you know about what was happening within the home and whether they were getting new residents and that sort of thing?
Yeah, I mean, the only contact we had was when we called the home, and every time my mum or I called the home, you know, we'd speak to, one of the nurses, or we'd speak to one of the staff. And again, we knew some of these people, and we get and we go, oh, how's Robert doing? He's fine. He's eating, he's drinking, he's walking, that sort of thing. You go, oh, right, good. Has he got COVID? No, no, all good. They're all good. Everyone's good. And it was a case of, like, so much positivity was coming out that we thought they are doing a fantastic job. It's like 2 or 3 weeks into the lockdown, and we're going, they're really doing. Yeah, I know it was themes in the news, weren't there, about the lack of PPE and stuff. We go, oh, have you got everything you need at home? And oh yeah, no, we're all right. We're all right. Um, I mean, you weren't welcome to go down. I think that was the thing. I really didn't want you to go down to the home. Um, and if you did take stuff, you'd leave it outside, and then it would. But I think that was pretty typical with a lot of the homes. It was like you left the bag or whatever it is, and then it went into the clean room for a day, and then it made its way onto your relative. So yeah, I mean, the only source of info that we had was was by phone. There wasn't any, they weren't ringing us, or it wasn't any, email or anything, any update like that. Um, and the home did look a bit, it, you know, so I think some of the relatives went down and had a look through the window, and it just it uh it was, a lot of it was curtains drawn, and it whereas I suppose you saw some of the homes, and it was all, they're on the TV, and it was all, they were knocking on the window, and I go, oh, no, it wasn't, didn't have
Yeah.
that sort of vibe to it.
Okay. And when did you start to feel that things weren't right? What did you find out, and how did you, what happened after then? Because obviously the home closed, but you didn't know, did you, around that time?
No, I mean, I think the first thing we noticed was we were, I think my mum saw something in the local paper. Well, it might have been my uncle. Saw something in the paper. There was one resident, Royston, who was in his 80s, and he died. And I think his wife and his daughter raised some money to buy some iPads, so they could sort of communicate during the lockdown. And we knew Roy. We sort of see Roy around quite a bit. He was sort of famous for his cigar smoking and stuff, because he actually was. But it was, so we thought, oh, that's, oh, no, Roy, and so when we were ringing up, going, well, how's it going at the home? Is anyone had any issues or anything like that? And they go, no, 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 everyone's fine. We go, well, hold on, we were just read about Roy in the paper. They always go, oh yeah, sad about Roy. He died at hospital. I went, well, oh right, okay, so like you're saying, well, it wasn't at the home, it was at the hospital. Um, but I think we then heard of someone else who had died, and then it all got to a bit of a crescendo as we got towards, the end of April, and early May. And I think we got a we got an email from someone at Amicura saying that some of the residents might have to leave the home. And this was like really out of the blue. Um, and there wasn't really any information about why, or or what the next steps were, or it was just some of the residents were going to other homes, um, and again, I think if you send a communication like that, then you're going to expect. I don't think relatives are just going to go, "Oh, that sounds great, fine." They're gonna, they're gonna. It was so vague. It was like, "What? When? Why? What? Where are they going?" That sort of stuff. And then that's really when it started. Things were getting strange because you'd call up the home, and I mean, yeah, that they were under a lot of pressure, and we know that they couldn't be on the phone talking to relatives all the time. They got jobs to do, but the kind of mood change. It was a bit sort of, it's not in our hands now, or we don't know what's going on, and we're going, well, if you don't know what's going on, then who does know what's going on? Um, and there was still, even though it was getting fairly evident that people had died there, they were still saying no, nothing had happened, no one had got COVID, it was all fine. Um, Even though the evidence was really mounting up, really. And I think one lesson we could take from here is, I work in communications, right, and I do a lot of in my time I've done a lot of crisis management and defence, right. So in situations like this, you're always going to get someone like me who's just going to dig and dig and dig until they can't dig no more, and if I wasn't getting answers, then I'd carry on until we got answers. And I rang anybody I could ring, really. I rang, yeah, a lot of the organisations you were showing on that diagram. I called, and the response was, it was either no knowledge, or it was all, or either a bit of like obfuscation. It's just like, who are you, and why are you ringing? I don't normally deal with people like you, sort of thing. Um, so but the strange link here is, again, for my uncle. My uncle, who's in his 80s, he used to work at the Evening Telegraph, and he'd been in contact with a journalist called Sarah Ward, who'd been looking at Temple Court, and also, the two general hospitals for quite a while. And she couldn't get any answers either. And so I rang Amicura. I talked to the chief exec there, and he said, and it was unprompted. He just said, it's all gone very wrong at Temple Court. It was all fine until these new residents came in. And again, I didn't know any knowledge about this at all. It's all a bit like, what are you saying? And then the alarm bells really did ring at that point. My wife put a message out on Facebook calling for other Temple Court relatives, and I think we got about 8 that said that their relatives had died, and also they said that they didn't know that anybody else had died. So it was a case of like, they thought they were on their own. They thought it was just them. And just some horrific stories about how how their relatives died and how it was handled and all this sort of thing.
Simon, can I just ask about when your dad was moved to other accommodation, because that's important as well, isn't it? About how that was handled.
Yeah, the sort of timeline of it was, I think, the just to add on to that. I think on the Monday before it closed, I spoke to someone at Amicura, and he basically said that 18 people had died, and that was the first time we'd heard of it. And then the story just blew up everywhere. But and then on the Tuesday, we get a letter from I don't know where, saying, I don't know. A letter might have actually the letter might have come afterward, but basically we got a call. I think midday on the next day, saying, "Oh, your dad's moving. He's got the home's closing and he's moving." I go, "Where's he moving to?" He says, "We don't know." So "Wait, how do you mean you don't know?" It's like, so well, can we go down there and get him? No, he's already gone. But like, gone where? Um, and again, my dad didn't know anything about anything really, and he arrived at Shire Lodge in Corby uh, in an ambulance, and I think by the looks of it, he just went up to the front door, rang the doorbell, and went, "I'm Robert. I'm really tired." Um, he didn't have any of his medication. He hardly had any of his clothes. And I mean, and luckily, uh, Shire Lodge, yeah, a bit like a bit like Mary and Joseph. It's like like they took him in and got him sorted, and then that they eventually got in touch with us and went later that day to go, "Oh, we your dad's here." But we didn't have any say where he went or how he went or what he had, and we didn't know what medications he had. They didn't know what medications he had. They didn't know what his COVID status was. Um, but I mean, on the upside, he did well in Shire Lodge, and he was there for a year and a bit, and yeah, but he passed away in last August. So, but the yeah, he it worked out weirdly. It worked out well. So, but the communication was just then we got a call and from someone from either council or somewhere, just sort of saying, and this is all post event, all after it had happened. It was like, yeah, he's moved to Shire Lodge in Corby. Like, okay, we know that now because they rang us. Oh, have they? Oh, and it was like, and they were going, well, are you happy with everything? Are you happy with the move? And all I went, well, not really, no, not really, because when he said, right, well, that's the end of that. Thank you. And it was like it's going, we've done our job. Great, we're off. And
Okay.
again, a bit like you then have to pick up all the strands of it, and just
Mm.
a real lack of info. But again, I think again, it all just went on to Shire Lodge's hands then,
Mm.
and I think they took two or three, I think, from Temple Court. But
Okay.
yeah, and again, we didn't have any of his details. We didn't know what medications he was on. All of that. There was no transfer of his file or what he was, and yeah, it's all quite difficult really because, say, I didn't have any knowledge of him.
Okay. Thank you. I think it's always really worth hearing it from, from families and understanding your perspective. So you've got 37 people on here as practitioners. What key points would you want them to take away from today?
Yeah, well, I've been thinking about this, and you know, I know you're probably thinking, well, yeah, so what? But here we go. One thing, I mean, I work again. I work in I've done other crises, right? And I think what was astounding by this is that from the time of the lockdown to the time that home closed was a space of 7 weeks, 8 weeks, of which 18, 19 people died, right? uh, you know, where then that in I know COVID really shook the playing field, as in what was a crisis, but this is still a crisis, right? And what I would have liked is any of those organisations that were listed in that diagram to step up and say early on, this isn't working out. And it because I think again, sometimes in my role, the crisis if the crisis hit the papers, it's way too late, and all you can do is just damage control and just sort of apologise. The bravery part is a much earlier on, isn't it? If someone was brave and just said, "This is not right," you know, things could have been very different. Um, and I think that you know, as time burns on, I think you know, seeing something and thinking, yeah, this is, you know, just using your instincts and just saying that this isn't right. And I think if you're feeling that you know relatives won't take it, you're trying to be sensitive to the relatives. They want to know. They want to know. And I think to what Heather was saying, I think that was clear in the report meeting that we had. People feel guilty. People feel guilty that they put them in that home. Um, and and also it was like, how could we not know, or how what, you know, from a relative's point of view, I wish I'd have intervened, you know, in the first week. I wish I'd just gone down there, got him in a car and got him out of that place. um so I think it's yeah, it takes someone to sort of, you know, just don't wait until it gets gets out of hand. And also, I think the second thing I think is, don't assume that a pain in the ass like myself is going to blow it. We we will. I've done this before. It's not the first time. And you know, I had the lady from the CQC telling me to f off, and I'm fine with that. Absolutely fine with that. I said to her, I said, "You're a disgrace. Your team didn't get there until the day it closed. That report was a waste of time." Um, and she talking to me like she'd never been spoken like that before, and it's like, you know, I'm looking in from the outside. I'm just thinking, this is your job, and you didn't do it. It's so just to bear in mind, I think because you can get a culture where is a feeling that we need to manage the media or manage the situation. You don't want to get into that situation. You don't want to do that, because you're not going to win that game. Once you start once it's gone that far, the media will just descend and pick and pick and pick, and your story is then in their hands. It's not in your hands. So I mean, I think have that in the back of your mind that no matter what's going on, things will come out. Things can come out. So I mean, again, I think the golden rule is just communicate as plainly and simply as early on as you can. Break it down in terms of what you're going to do. And I think, as I say, just thinking of your end client, just thinking of them
Mm.
like yourself. I mean, it's like, what would, you know, if someone said something to you, um, and you didn't understand it, it's like, well, that's a bit of a fail, isn't it? So that's my thought. I mean, it's
Brilliant. Thank you. No, that's really, really helpful, Simon. I say, sitting in your position, and it's interesting about your background as well, because I was going to ask you that, but no, thank you. I think if we can, I'll just summarise what we got out of the conversations with the family. Simon, if you'd like to stay, please do and chip in.
yeah,
I'm
I'll
going to
hover around.
do a
Yeah,
little,
yeah,
yeah, I'm going to do a little exercise in a second and just hopefully get some feedback from people on the call. I mean,
yeah,
I've just popped on the slide there. You know, some of these quotes were from some of our families, and as I say, I go back to, you know, what was it like for people. People felt very guilty that they couldn't help their families because they didn't know, quite frankly, what the situation was. So, you know, it is really important to understand their perspective as well. Just go to the next one, Chloe. I'll just summarize um, what we didn't do as a panel was ever seek to analyze the family's input and their perceptions in any way, because quite frankly, you know, they gave us so much information, and you know, it is also, I think, from my perspective, I think it's really disrespectful to then start analyzing it as part of a review. They told us in good faith how it was. Say that the key themes really around this were the discharges, both from the acute hospital and hospitals, and also then the move from the care home to other accommodation. There was that lack of choice, and I will pick that up because when people were discharged from hospital, there wasn't a choice. The government took that away in the national discharge requirements, so they didn't have a choice. But that, you know, quite clearly wasn't explained particularly well to families. As I say, most of the families were really sympathetic about staff who worked within the care home, and there were some excellent staff, some excellent nurses, and we had some of the agency staff come to our practitioner event. They were really open and candid and very committed. Simon's talked about the deterioration in the quality of care over the time and the changes of manager, which undoubtedly affected that. The staffing levels also commented on by most people, and the real reliance on agency staff, and then hygiene, cleanliness, medication, the kind of activities, and how that deteriorated. So as I said, if you keep in mind, it's not just about COVID; it's about all that that led up to March as well. Communication we've talked about, particularly important, I think, is what Simon said. You know, the playing down of concerns. The family's ringing and saying, you know, how is my dad? How is my wife or whatever? Oh, fine, you know, no issues. And actually, there were. And then in relation to sort of poor visiting arrangements for people who are at the end of life, if you've read that within the report as well, you kind of know that you know, there was a particular lady who mentioned she'd gone in at the end of her husband's life, and she was really quite distressed because of the calls for help from some of the other residents and nobody attending to them, and just not enough people around really. So those were the kind of key themes. I wanted to kind of make this learning event the same as the last one and do a little bit of an interactive uh, session now, and use the chat because I'm not good enough to to use the whiteboard on here. So what I'm going to do is just give you 5 minutes and ask this question really. So what barriers do you think there are to hearing the voice of individuals and families? And that's really, you know, in general, not necessarily just in terms of when you get into a pandemic situation. And from your perspective, in whatever role you are, what needs to happen to ensure real meaningful communication? And I think you've had real benefit of Simon talking today. But if you can just have 5 minutes on those two questions and pop your thoughts in the chat, and then we'll pick up a few as we go through. So just 5 minutes to think about that, and then we'll come back. Okay, brilliant. There's some really great comments coming in the chat. I always feel like when we do this, I ought to play some music in between because it's deathly silent. Okay, can I just pick on a couple because I think there's some really good ones here. Diana, can I pick on you for a second? You've talked about better leadership, setting examples, respect, and history.
Yeah, I work in dolls, so I go into a lot of care homes, and staff don't know the person.
Right.
They don't know the history. They don't know who they are. So how can you like respect how a person's behaving or what they're saying to you if you don't know anything about them? And I think often in homes there's a culture that develops, and people very often, instead of presuming capacity, they assume they lack capacity in all decisions in their life. So I think it's very much about culture. I think it's about leadership. So you set by example. So I think if the culture around you is one of engagement, one of listening, one of being proactive, that breaks down the barriers straight away. But if individuals aren't doing that, that culture still stays there, doesn't it?
Yeah, absolutely.
It's hard to fight a culture on your own when you're one individual, working with a team that values are very, very different because they haven't learnt anything. I mean, I think it was interesting what Simon said about the staff maybe worked in a shop and it's their first job as a care professional or care worker. So how did they learn? How did they learn to do the job? Because it is a job, but there's skills to doing the job. And I think I question that sometimes about what training staff have, and do other staff challenge other staff when they see bad practice?
Yeah, absolutely. I was going to ask you, how do you feel about being able to challenge that, and where can you go to feed that in? If you went into a particular residential home, care home, and thought, "Oh, it just doesn't feel right," would you take that anywhere?
Directly to where it is occurring, yes. I
Yeah.
would say, I don't understand this. Why is that happening? Can you just tell me a little bit? Because I really don't understand what's going on here. And I often take it to management as well in the homes. If they've got a poor CQC rating, I will ask, well, what are you doing? What's happening? How are you improving that? Who's working with you? You're working with quality. So I've been doing the job, I think, too long to walk in and then walk out and not say anything. I'm sorry.
No, that's exactly what we want. Exactly. No, that's brilliant. Okay, thank
Thank
you.
you.
And just Carol Ann, you talked about difficult families, people being labelled as difficult families. That used to happen on my primary school. We used to get DF put on our cards as being difficult families for students. How do we get around that? Don't know whether Carol Ann's coming on.
Yeah, I was just struggling to find the mute. But I think, as Diana was talking about culture, I'm also in the dolls team. Right. It actually comes. I think your leadership. It comes from the top, and we can see it. I think coming through some of the things that's been said in the Temple Courthouse. The families were saying that initially, they were perhaps quite happy with one manager, and then again, the management changed and things started. Sometimes you do go in, families are not being difficult. They've identified, what's happening to their relative, and clearly they're wanting that to be put right. But sometimes you have such this level of, not all to be fair, level of defensiveness. About when you're actually bringing it up. For example, there was one dolls that I had a condition on it, and that was for the home to sit down and have a conversation with the family. It was a very short dolls authorization. It hadn't happened by the time I went back in. So again, it did happen after that, but I really did have to be very assertive, because again, they were just seeing them as a difficult family. They were not a difficult family by any means. And sometimes as well, I remember an issue with another care home manager that the family had. And to be fair, I do think this manager would have responded if the individual had spoken to her, but I think the manager really struggled to get that. Sometimes families can find it difficult to actually request things, because they have this belief that if they're doing that, it may reflect upon their relative.
Yeah,
and I think And I think that that's really sad. I think that families are so worried about raising things because they're worried about the potential knock-on impact on their loved one.
Absolutely. No, thank you for that. I think there's some really good points in the chat, and I think you're absolutely right. It is when you identify particular issues, it is about asking questions. It's also about the soft intelligence that comes from that, and being able to feed that back into the quality monitoring, shall we say, within your local authority, within your quality monitoring teams. So if you go into somewhere and have a concern, then act on it. Absolutely. Okay, brilliant. Thank you. I'm conscious of time, and I just want to move on to talk a little bit about what happens when we get into a situation of a civil emergency, for want of a better word, a pandemic, in this case. So a lot of people hadn't heard of the emergency procedures, the local resilience forums that were set up when we went into this whole it was pre-lockdown actually, to deal with what was happening. And I thought it'd just be useful to kind of look at this and the link with safeguarding. So there is another set of questions at the end of this. So we just want to get through to there. So just move on to the next one, Chloe. I have a background of being a police officer for 30 years, and I have chaired a local resilience forum in Lincolnshire previously, so I had a little bit of knowledge around this. But when we got into this situation, an awful lot of people who were in my situation, I'm a Safeguarding Adults Board chair as well, didn't really understand how we fitted together and what happens and how it's all structured. I just thought it'd be useful because this is a big part of the review. So the Civil Contingencies Act of 2004 came about because of the it was actually following a fuel crisis, severe flooding in 2000, and the foot and mouth disease, if you can remember, in 2001. And then it was also built on following the London bombings a few years later, and there was a whole programme of joint emergency services interoperability. There are 42 local resilience forums in the UK, and they're based on the policing areas. So, Northamptonshire have got one police area and one LRF. It's not a legal entity, and it cannot really direct, but it's about having a collective responsibility around business continuity planning, preparing for emergencies, communicating information in a multi-agency environment. And there's two categories of responders. So your category ones are your police, ambulance, fire, local authority, and the NHS. And category two are utility companies, transport and telecoms. And usually, arrangement, as you all know. The category one responders must maintain what's called a community risk register. And from my days within the LRF, a pandemic was number one on the community risk register, a flu pandemic, and there was quite a lot of planning around that. I think if anybody's sort of been following the COVID inquiry, it's pretty apparent that as a country, we weren't ready for something on the scale of COVID. The plans that have to be made for any eventuality is around that cooperation, the information sharing between the agencies, what response you put in, the actual emergency planning, business continuity, keeping essential services running, and informing the public. We used to call it warning and informing. And that's what the kind of structure, that's the sort of background to how the structure operates. Next slide, Chloe. I'm not going to read this, it's just for your information. You know, this is what Northamptonshire's LRF is, who it's made up of, and their responsibilities under it. I'll just give you a second to look at that. Okay, and then just on to the next one, Chloe. So this is the sort of basic structure as to how a resilience forum comes together. And it's not, I haven't sort of gone into any huge detail with it, but basically at the top of the structure is your strategic coordinating group, and that is a multi-agency group of senior leaders, your chief executives, your directors of adult social services, police, gold commanders, etc. And they will sit in the SCG, and their aim really is around providing that strategic leadership, setting the strategy, the aims and objectives, and regularly reviewing theirs based on what information's being pulled together. They're responsible for developing as part of the response that single picture of what's happening within their area. And it's fair to say, in most situations, the LRF is stood up to manage a local emergency and then feed that into the national arena through a regional route. And in this situation, it was very different, wasn't it? You know, the government were managing the situation and providing the guidance and direction centrally. So it was slightly opposite to what normally happens. So you get your strategic coordinator group. Below that, generally, there is a tactical coordinating group who then develop the strategy into a tactical plan of what needs delivering. And in this case, there was a health tactical coordinating group. Sorry, an emergency. It was the emergency preparedness, resilience, and response group, which really rolls off the tongue. Sorry. And then sitting below that, you will have a number of multi-agency cells. You'd have things like mortuary arrangements, PPE, the provider hub, hospital transfer cell, which becomes important in a minute, and communications, etc. And the one of the cells was the hospital transfer cell, and that had to initially free up 200 beds within the acute hospitals. Next slide, please, Chloe. So just in terms of the sort of key areas around this, we looked in the review around the hospital discharges and the admissions to care homes. And what you have to remember is there was no routine testing, certainly up until the 20th of April, of patients leaving hospital. So COVID status of individuals was generally unknown. As we say, the LRF commenced on the 3rd of March with their first telephone conference, and the initial discharge plan, the SCG, the Strategic Coordinating Group, basically say go away, produces a plan of how this can happen, which was developed. And one of the things that I found through the review was there was no evidence to suggest that initial plan in the first few weeks had gone back to the Strategic Coordinating Group for sign off. After the first few weeks, it was looked at again, and there was much better oversight in terms of how that operated, but that initial plan didn't go back. The national guidance that was issued under the directive from the government talked about 4 key pathways. Pathway 0, which was patients who would be able to go home without any additional support. Pathway 1, patients who required some sort of support at home. 2 were patients who would be transferred to other bedded facilities for assessment, and 3 were people who required longer term care. the guidance, helpfully or not, gave some percentage of what of the numbers of patients who would potentially go down each pathway, and the majority would have, according to their guidance, gone home. We haven't been able to ascertain the percentage of patients who went down each pathway part of the review, despite really trying to drill down into that. And one of the other things as well was that there was a recommendation very early on in the middle of March made to the strategic coordinating group that people who were on pathway 1, i.e. could have gone home with some support at home, were instead to be moved into other accommodation. And whilst that was approved as a recommendation from the SCG, what we've been told by senior leaders was that going into a bedded facility should have been a last resort. But again, I'll go back to the fact we weren't actually able to put the numbers down as to who went into what percentage actually moved into accommodation. The criteria for the selection of the accommodation where people moved to slightly changed, but there was nothing that suggested that homes that were rated as requires improvement shouldn't be used. But what they didn't consider was, well, do they need any additional support if we are going to put patients into homes with those ratings? The CHS, who were doing the brokerage, if you like, between the hospital and the care home, they said they weren't to use care homes that were deemed to be inadequate. And as we've already seen from the findings, the rate of the discharge is really significant during that short period of time. So the learning from that part of the review was saying, there needs to be greater oversight by the local resilience forum, the hospital transfer cell and the provider hub and the senior management at Amicura to monitor, excuse me, to first of all think of the impact about what might happen if you put 23 new residents into one location. Are they sufficiently able to manage those individuals and manage individual need? And as I say, when using organisations, when providers who are requires improvement or inadequate, what sort of support, what level of support, enhanced support do you need to put in? The speed of the discharge and the supporting information that went with the patient also needs to be as good as it possibly can be. And we've talked about, it wasn't as good as it could have been in some situations. And the bottom line really is all placements, whether it, and I know this is an emergency situation, but in all scenarios, they must be the right setting and personalised to those individuals. And to be fair, the registered manager did refuse 4 patients transferring into Temple Court because they could actually meet their needs. Going to the next one, Chloe. So one of the other areas we looked at, which is linked to keeping people safe, was around infection prevention control. And I just wanted to pop this in here because I think it is really important around good practice and thinking about how things are managed within providers. The responsibility for IPC obviously rests with the registered manager. At this particular time, obviously, the guidance was significantly changing on a daily, hourly basis. If you recall, there was lots of different guidance coming out, and I think it's easy to say with the benefit of hindsight about what should happen, but the experience at the time was ever changing. So routine testing for patients didn't start in Northamptonshire till the 20th of April, but that was actually ahead of others. When we did the practitioners event, they told us that the measures within the home weren't sufficiently embedded. And if you think about, the numbers of staff required, particularly with dementia patients, and being able to manage people who wander, and being able to maybe isolate or cohort individuals is really, really difficult. The senior managers from the home said to the review that their understanding was that when new residents came to the home, they would be isolated for a period of time. But from the practitioner's perspective, that wasn't happening. And there was no real check of that or oversight by senior managers at Amacura. So what they thought was happening, they didn't check that it was happening. In terms of good practice, we recognise that there was some good practice around information being disseminated when there were outbreaks, and there were multidisciplinary meetings being held, so the information was being disseminated. And again, going back to the culture issue, IPC's got to be embedded as part of the culture, and management within providers need to make sure that it is embedded, and that staff know what to do. And that again comes down to risk assessments for residents, for staff, and for family members, as a minimum. One of the things I did suggest through the learning was, and I know they are often they are looked at, IPC measures within quality monitoring, but can you put something into contracts to make sure that there's got to be a demonstration that they can comply with it. And one of the things I'd point you in the direction of is the CQC guidance. They've got some really good effective outbreak plans that you can have a look at and use and promote. Next slide, Chloe. I've just got somebody who's come off mute. If you just check your mic, that's good. And then in terms of that guidance and support to providers, that management oversight and grit, we've touched on that already, and talked about where care providers or care associations actually fit within that emergency structure, and I think they're really quite key to it and could be really embedded in there. The information and guidance that was provided by what was set up as a SAR, a provider hub, there was lots of evidence that there was an awful lot of information that went out to providers, but what I couldn't find was evidence of any proactive calls to Temple Court, weekly calls to providers. There was opportunities for providers to dial in to sessions with chief nurses and various other things. But one of the things was also that the uptake of that sort of offer wasn't monitored. All of the providers were asked for business continuity plans, and Temple Court didn't submit one, but that wasn't followed up to see whether they got one, whether they'd it had just been an oversight. As I mentioned earlier, there was a couple of opportunities fairly early on in April when there was some missed opportunities to kind of delve into what was going on within the home, and it wasn't until the 20th of April, say when the quality improvement nurse called the home, that it was discovered what was happening. Ultimately, it is that responsibility of a provider to make sure that their service can remain operating safely. We talked a lot in the review panel around that business continuity and the responsibility of managers, no matter what size organisation you work in, and even if it's a small organisation, if your responsibility for providing a service to really vulnerable people, it's your responsibility to make sure you can maintain that service when things go wrong. And it's not just about a pandemic, it's potentially also things like you can have flooding, you need to close your care home because of you've got to move out, a fire, or there's norovirus or something like that. You've got to have those plans in place. So the learning, greater involvement of care providers, that proactive contact with the care homes from the emergency response from the provider hub, and providers needing to make sure that they have their business plans, their continuity plans, that they're current and they reflect learning, particularly from this review. And also a suggestion that the business continuity plans could be checked as part of any kind of monitoring that goes on within the providers. Another suggestion and recommendation that I've put within the review is about really embedding enhanced healthcare to care homes, which is a programme that first started in, I think it was about 2019. And quite a lot has been embedded within North Hants. It's about primary care networks, providers and the commissioners of community health services and social services working together to deliver a more sort of personalised care to residents in care homes. There is, and I haven't had a chance to have a look at it, there's an updated version from November 2023. So you may want to go away and have a look at that. It's got principles really around it about personalised care, co-production and collaboration, quality leadership, and digital technology. And essentially care homes are aligned to a primary care network. They've got a named clinical lead, they have weekly ward rounds supported by a multidisciplinary team. There've got to be information arrangements for information sharing, etc. But I think it's really important that that particular program of work is really, accelerated if it's not all there. And I know it's a really difficult and challenging time for all services, but I think people deserve to have that personalised wraparound care. Okay, so the final bit I'm going to ask you, if you just move on to the next slide, Chloe. Just thinking about, we've talked about the kind of emergency situation when it happens, even when you've got really challenging situations, which we've got now, cost of living, winter pressures, etc. Just from thinking about today, thinking about what Simon's input is, what we've looked at through the review, and when we find ourselves in these really difficult situations, how do we as professionals keep safeguarding absolutely at the forefront of our minds, even when you're in an emergency situation or this sort of challenging situation? So you just think about a few points and come back in 5. Thank you. Okay, brilliant. Thank you for that. I've got some good points in there, lots about what comes down to professional curiosity, asking, don't be afraid to ask, challenge if something doesn't feel right, making sure care is person-centered. There's a really lovely quote in there, treat everyone as if they were your loved one. Absolutely. Gathering evidence, again, don't forget the purpose of our roles. Yeah, absolutely, spot on. I think I'll just nip onto the next slide, Chloe, and then I'll pick up on that bit. Okay, so just in terms of when we're safeguarding and you are in this type of emergency situation, safeguarding adults remained that statutory responsibility, and despite there being certain things under the Coronavirus Act, which was about easements for the local authority in their assessments, and the development of that ethical framework for decision making, safeguarding adults was still that statutory responsibility. And I think one of the things that we have kept coming back to when we've been doing the review is, there is a responsibility on everybody, no matter what situation is happening, to safeguard adults at risk. So that is the main purpose for all of us. And even when we were within the periods of lockdown and restrictions, it was very much the fact that organisations had to continue to monitor the safeguarding activity. What was still coming in? What were we still worried about? Where was the information coming from? I think one of the things that I would take away from this around how things happened here is around impact, and it's the big one for me really. Whenever you make a decision, whether it's based on a local policy, whether it's something that's come from government, or you're going to take a particular action that affects people, it's thinking about the possible consequences and the impact of that decision. So for me, decision making is done in a collaborative way as far as possible, and identifies and monitors what the potential impact is and what the real impact is. So before making that decision, thinking about who's my key stakeholders, how's this going to land, and who might I be putting at risk with some of the areas I'm sure were thought about, but I can't demonstrate it through the review and through the evidence that I pulled together. I think one of the other key things for keeping focus on safeguarding is about training. Making sure people absolutely have their safeguarding training, thoroughly understand that it is a preventative activity, and that again, it's not about blame. It's about trying to find a solution and keeping people safe. Very much everybody understanding what is a closed culture, how it happens, what are the risks, what you can do about it, and then just thinking about culture generally, which has come up a lot again today. The people within the organisation create the culture, and there's a really good toolkit on skills for care if you want to have a look on there. I'll pop it into the chat at the end if you want to pick that up, but it is a really good toolkit to look at. And again, thinking around the quality monitoring and making sure that that's joined up across agencies through the local authority, through the ICB, through the CQC, and that making sure that every bit of information it's important, and all that soft intelligence and what patients and what families are telling you gives you that big picture. Certainly when we were first in those few weeks of an emergency, the understanding of LRFs and how Safeguarding Adults boards in particular could link into that was a bit patchy across the UK, let's say. And I think really from a Safeguarding Board's perspective, it was really good to be able to just think about the risks, what might be happening, and ensure that you kept your links into all of your contacts and your care associations, and being able to feed potential risks into the emergency response. And then finally, really, if you've looked at the recommendations from the review, there's recommendations for understanding the learning from this review for the LRF and sort of emergency planning, which I'm sure they'll take away. Mark's just popped onto the call, and the quality monitoring aspect, and also, you know, about business continuity, etc. But I think all in all, the big thing for me is the impact and thinking about that in any kind of situation. So I think we are about there. Thank you so much for your input today and your feedback and coming on and speaking. I'd just like to really say a massive thank you to Simon for being here today. It's just so interesting listening to your experience and how it could have been different, and hopefully all of us will take away, you know, the real importance of including individuals and families in whatever we do. If you want to look at the previous learning event, which was on the 6th of December, that really does pick up organisational abuse, culture and safeguarding. So that is recorded. But again, all of the review documents, the main report, the summary and the learning brief is all on the website for the Northamptonshire Safeguarding Adults Board. So I'll stop there and say thank you very much for being